All right, I'm gonna just think we have one more person to join. And then we will get started. Yay. My son's excited. Quinn, you can see my screen, I assume?
Yeah, it's perfect.
When I do this, of course, I can't see anybody else. I just want to make sure Elmo is in here.
I don't think they've joined yet.
So a quick message. So while we, again, when I go to full screen, I can't see anybody, so I'm make sure still missing Elmo. And Denesha's still at work, so she'll talk when it's her turn, I'm assuming. Just make sure Elmo's here before I begin. So let me see where he is. Give me one moment. All right, Elmo, I call him the OG, and I'll explain that later, but, he's been here for a while, so, technology is a little harder, but he's working on it. So in the meanwhile, we'll get started. We'll just jump around a little bit. And I'm just going to reshare my screen. Okay, so sorry about that. Welcome, everybody. This is our first ACP corner, and I'm Artur. I'm one of your hosts. I'm one of the neurosurgery PAs here, and I have pulled together some wonderful people to talk to you all and tell me about themselves as well. And we'll bounce around as necessary. And I'm sure you can see on the screen, we have Denesha, Andrew, and Allison with us. I'm waiting for Elmo to get in. As you can see here, I call him the OG because he's been here back when I was a student some 17 years ago. So again, technology is a little tougher, but I guess I would start by saying what's an ACP and what are you guys even here listening to it? If you're unfamiliar with ACP, we're called Advanced Care Providers here at Lenox Hill in the Northwell system, and other verbiages, APPs or Advanced Practice Practitioners or mid-level providers or PAs or NPs. Or even in midwives. So that's what constitutes us as ACPs here. And there's very, very many of us. I saw somebody ask a question in Dr. Langer's talk, does he work with PAs? Well, neurosurgery, my team, is about 21 or so PAs strong. And I know that the ambulatory part of Dr. Langer's practice has about 7 or 8 NPs. So we do all work in big groups and big teams in the hospital as we equals among all care providers. And I did a talk last year for Brain Turns describing what a PAs, and I just call us awesome troubleshooting therapists that just get things done. Like that's what I think about my job. But we do encompass so much, and we all have different journeys, and we do different things, and we expand differently. And we don't just do clinical practice, we're also involved in education. We're getting into administration. And we're really a big part of the health system now, as opposed to when we first started, where really people didn't know what to do with us. And, I think, what's important for those of you who are contemplating getting into medicine, be it a neurosurgeon or neurosurgery PA, it's important for you to know what your options are. And I think some of our panelists here will be able to tell us about their journeys and where they see everything going and pearls of wisdom. And I think that's what the point of this week's talk is. And, you know, I don't want to really talk about myself in terms of journey to get here because it's not that exciting. I did culinary school in high school. My teacher told me, go be a PA. And I'm like, okay. And here I am. So it's been a wonderful accident. And everything I picked up along the way, just as a okay kind of way, was always a wonderful thing. And I think that speaks to who you are as a person, your personality and your adaptability. And I went from a PA student in this department many a year ago, way before Dr. Langer Northwell showed up, with Elmo being my preceptor, to now being a supervisor on my team with my colleague here, Vadim, who's gowned up in full PPE gear. And we get to manage this wonderful team. It's a big family unit. And I get to be involved with a lot of shadows and a lot of the patients that come through the hospital. And I look to the future. It's very bright for the profession, for all of us. And, you know, moving on, I wanted some other wonderful people in our hospital to talk about themselves and their journey. I'm going to let Denesha take over. She's a supervisor in the general surgery department. She's been at Lennox probably as long as I have, and I hope she can unmute herself and take over.
Good morning, everyone. My name is Denesha. I'm one of the general surgery PAs at Lennoxville Hospital. I've been here for 10 years. This is my first job. So initially, I thought I was gonna, when I graduated high school, I went to high school for performing arts. Initially, I thought I was going to be a dancer and I was gonna travel the world. As I realized, like, wow, what actually goes into traveling the world and becoming a dancer and the wear and tear on your body, I started saying, okay, I wanted to look into something in the healthcare field. I didn't know what I wanted to do. So I said, okay, let me just do all the prerequisites required for like physical therapy, PA, dentist, doctor, whatever, and other specialties as well. So then once I started shadowing each specialty, I started with physical therapy initially, and I was like, okay, this is not what I want to do. I shadowed dentist and also MD, and I was like, this is not what I wanted to do. So one time I had a dance injury during the time when I was in college doing my prerequisites for everything, and I actually sprained my ankle. So I went to the emergency room and I got treated by a physical therapist. So once I got treated, not physical therapist, I'm sorry, physician assistant initially. And I said, who is this person? I said, they're coming in here, they did an x-ray, they examined my leg, they examined my foot, they made sure I didn't have a fracture, but I did have a really bad sprain. So they did split me, like wrapped it up, and then referred me to ortho. And I was like, let me find out more about this career as a physician assistant. And then when I went to the orthopedic doctor, I was also seen by a PA. I'm like, wow, they're doing everything and they know so much and they spend so much time with me. And I said, this is what I wanted to do. So the next thing I did was I completed my prerequisites, of course. Of course, then I went to shadow a PA for a whole 2 years at Woodhull Hospital doing endocrinology. And I said, okay. He's like, it's time to apply now, Denesha. So I said, okay, I'm working on it. I was a bit nervous because I was like, this is really competitive. So I actually only applied to one school, and that was SUNY Downstate. I got into that one school, and that's where my journey started in Brooklyn. It wasn't easy. My didactic year, I still lived at home in Queens. I used to wake up at 5 o'clock in the morning, drive out to Brooklyn, classes didn't start until 8 a.m. After my 2 years, I took some time to take my boards. I took it most in January of 2012. I passed. So I was like, you know, I'm just going to go for surgery. I want to do this. I want to do that. Initially, I wanted to do ED. So any job that I did apply to, and they got back to me, was actually surgery. So I said, okay, this has to be my path. So the first job I interviewed at was Lenox Hill. They got back to me within a week, and I interviewed at other places as well. So the first offer I got at Lenox Hill when Jonathan Sobel was director. And I was like, I love this place. I loved his energy. I love Teresa as well. And I've been here ever since. As being a PA on general surgery, we do work nights, we work days. We scrub into the OR as well, where we work on a team with residents as well. I rotated through the OR, overnight shifts, we do consults as well. Then about in 2016, I started my MBA at Hofstra, and I completed it in 2018. And last year, December, I was promoted to general surgery supervisor. My journey to becoming a PA wasn't easy because within that time, my father passed away. So that's why I delayed me like actually applying, because I was going through a lot of other traumas in my life. So when my parents, my mom just pushed me and said, okay, this is what your father would want you to do. And during that time, as like I said, I was in PA school still dealing with that. I actually did amazing. So if you're going through something, just keep pushing through and have a strong support system. You'll get by. I love being a PA. I love my job. I like working with NPs as well. They fulfill the advanced care providers here. We intertwine. I feel like mid-level providers, we have a great career outlook, and it's only going to get better from here on out. Like Artur said, you can either go into an administration job, and once you have been a PA for a while, if you like more of like, I want to see how the hospital runs and get implemented into new policies, or if you just want to just come to work and just do your daily job, that's possible as well. Our lifestyle is great. I know as a general surgery PAs, we work normally 3 days back to back, and then we have 4 days off. Also, as a general surgery PA, I also had other per diem jobs in psych, emergency medicine, and also urgent care. So it's actually very, very flexible. So if I were to do it all over again, I would become a PA, but I would have pushed myself sooner. As soon as I graduated from college, just go right ahead instead of just trying to figure out what I wanted to do. As soon as I fell in love with the career, I wish I would have just pushed myself through and not been so scared. And these are my colleagues in the slide. They're all amazing PAs. We've been working with each other for 5+ years, and we're a strong general surgery family. Any questions?
We're gonna do questions a little later. Thank you, Denesha. I think it's important as I put pictures of my team, you put pictures of your team. You know, somebody asked, what makes a good neurosurgery resident or a good resident? And Dr. Langer had some thoughts. My one thought is be a team player. There's no I in team, they say, right? So be a team player, and we want to spotlight that. That's what we do, and that's very important to us. I think we're still waiting on Elmo to get on, so we'll come back. So I think we'll let Andrew take over. He's no stranger to brain turns, and he can introduce himself way better than I can. So I'm just going to let him take over.
Thank you, Arthur, and thank you, Brain Turns, for having me. So my name is Andrew Wong. I am one of the critical care advanced clinical provider managers at Lenox Hill Hospital. I have been in the field of medicine for probably over 20 years now. And one of the great things that I've always learned was about the different lessons. And so a little bit about my journey. I started off at the age of 16 in high school, where I was taught to be what was called a certified first responder. And that's part of the emergency medical services world, where I rose in the ranks in the emergency medical services. During that time, I had the wonderful opportunity to hold a bunch of different leadership roles within the emergency medical services, anywhere from becoming a chief of operations to the president to treasurer. And it gave me a lot of leadership skills and taught me a lot about my passions, which has always been education and elevation of practice of those who are around me. Um, After I rose in the ranks, I was an advanced life support provider, and I started off as what was known as a clinical assistant in the emergency department at Stony Brook University Medical Center. And what I loved about that job was that I had the ability to care for people, be able to kind of be have tutelage alongside, and I learned one of my true passions was critical care and trauma. Um, During that time, I grew up at a young age, at the age of 18 in the trauma bay. I always said it was the trauma nurses who taught me how to become a nurse. And I learned alongside them. I also learned alongside amazing providers and physicians who taught me a lot of different opportunities. I always say most of the things that I do nowadays, whether it's assessment of a patient or whether it is being able to do a procedure, I learned from watching all the people around me. So I still remember the first time I ever placed a central line. I watched it being done a million times, and so I knew exactly what to do. So that was something that was really great and really lent a lot of things for me. And so when I because of the great leadership of the people around me, I had the opportunity to go to nursing school. And so I became a registered nurse. And during that time, I started off as a critical care trauma resuscitation nurse. And so for a new graduate, that was something that was very, not seen very often, and so I had the opportunity to work at a level 1 trauma center, University of Rochester Medical Center, where 80% of my shifts were working in the trauma bay, taking care of the most critically ill patients, and that was something that I loved, and it was a great passion for me. And as my parents got older, I decided to move back home, where I grew up in New York City, and so I moved back home to actually ended up at Lenox Hill. And during that time, probably within 6 months of me starting at Lenox Hill, I was asked to be their interim nurse educator. And so during that time, it was something that, I took a lot of thought about, because for me, I always was like, no, I don't know if that's what I want to do, but I always had a passion for teaching others. That was part of my role in the ambulance company, and doing those different types of things. And so I took on becoming a nurse educator, where I was the nurse educator for Lenox Hill Hospital's emergency department, as well as Lenox Health Greenwich Village. And I was one of the system critical care educators working for Northwell Health. That opened up a lot of opportunities, because I helped to run one of the emergency department fellowships. And really, what I always loved about teaching others and having the passion of others is that, as ACPs, we're force multipliers, right? So, just because I can take care of, 10 to 20 patients and do a good job for that, if I can teach it to others, my impact is much larger. I can even be taking care of thousands of patients through indirectly through the people that I've educated. During that time, one of the things, when you think back to my career path, which was emergency medical services, working at doing advanced life support, running around in the ambulance, going ahead and saving lives and doing all those fun things. And then also being an educator, I had the opportunity, when I was a nurse educator, to pursue advanced practice. And so nurse practitioners are advanced practice registered nurses. We have the ability to diagnose, treat, and look at things in an advanced practice role. And so after I graduated from advanced practice, one of the things the chief nursing officer asked me was, was it that I wanted to do? And that was a really unique question, because, I always thought about, well, how do I impact care, right? How do I impact, I can go work my job, I can take care of patients, but how do I impact a level of care? And so I had the opportunity to, as a nurse educator, to see what was called a rapid response in a hospital, or code blue in the hospital. And what those things are those are patients who deteriorate in the hospital. And we always want to think that, that never is going to happen in a hospital, but we realize that it does. And so when I describe this to people who don't typically work in a hospital, I always say, I took my passion of being a paramedic and working in EMS and I brought it into the hospital. So part of my job, we created the role of a clinical impact team. Our team is now went from, it was just me to now we have 6 full-time equivalent positions. And what we do is we try to provide critical care access throughout the hospital. I always say it's critical care without borders or without walls. And that means that if there's a patient who's clinically deteriorating, we're there, but we're not there just to take care of the patient. We're there to take care of the team members. And I think that that's the most impactful thing about our role, is that we have the ability to help elevate the advanced clinical provider, the resident, the doctor, whoever it is at the bedside, as well as the nurses, to really be able to provide the high quality critical care that everyone deserves. One of the things that I've learned in this role is that, it's not expected that everyone has to deal with an emergency, right? When you go into this, like Arthur's is in neurosurgery. He knows how to take care of neurosurgical emergencies, but it's not his expectation because he doesn't want his patient to deteriorate. And so what it happens is that on some of the more regional medical floors where it is not the expectation for this to happen, we're helping to provide a safety net, or really help to kind of close some of those gaps, to really provide consistency with emergency response, preventing unnecessary readmissions, and really promoting quality and safety. Currently, what I am doing professionally is I am going to be completing my doctorate in nursing practice, which is a doctoral degree for advanced practice nurses by December. So I am doing that. I am also adjunct faculty both at NYU as well as Hofstra. I have the ability to, what I love about that is I have the ability and flexibility to train baccalaureate nurses, so nurses who are just straight going into becoming nurses, and then I have the ability to train graduate nurses. And what's really unique about the opportunity to do that is that it's interdisciplinary training. I'm not just training graduate nurses who are either going into advanced practice, meaning that they want to work in a hospital or things like that, but I'm also training CRNAs, or certified registered nurse anesthetists. We help to train physician assistants as well, and working with all the interdisciplinary teams. So that's what's really been my passion. For those who don't know much about nurse practitioners, like I said, we're advanced practice nurses. I'm a dual advanced practice nurse practitioner. So I held board certification as an adult gero acute care nurse practitioner, meaning I work in the hospital, helping to work critical care. I also just completed my postmaster's as a family nurse practitioner, allowing me to really be able to stretch and go and do some more of the primary care type of things. So taking care of anywhere from birth to death, and really being able to help provide primary care as well. And so there's a lot of different opportunities and things like that. Just to summarize lessons learned, whenever we kind of do these presentations, they always say, well, what did you learn, right? Well, I think in anything we do in critical care, life is incredibly short. Really never take anything for granted, and really think about everything as a lesson. That's something I think over in my career that I've learned, that whether it's ups or downs, that it's a lesson, and always be open to learning new things. Once you get to that part where you're complacent and you're really just like, this is what I do and this is how we do it all the time, it really doesn't allow you to learn all the other things. And no matter what happens, always chase your passions and don't sell yourself short. And this is this is really much harder to do, because I always have told myself, I'm like, I don't know if I can do that. And it was really the people around me who really kind of said to me, no, you can do this. And now when I reflect back on it, it's really meaningful. I'll always tell you, if you're going to go into healthcare, no matter what role you're going to play, always know the why behind everything you do. I always tell people, and I taught this to my fellows from day one, I can teach a monkey how to place an IV. I can teach a monkey how to place a central line. But what you really need to do is you really need to understand the why. And if you have that passion, that's how you're going to deliver the best and safe care that's equitable for everyone. And then at the end of the day, just remember, we're all part of the same team. I think you guys have a really great, couple of weeks where you're able to see all different interdisciplinary team members. And it really takes that team to put everyone together. I think Arthur has the next slide, which kind of just shows what I'm really proud of. And what I'm really proud of is in my career, I've had the ability to be a part of multiple people's teams, be a part of multiple people's careers and their profession. And ultimately, that's all translated to practice at the bedside, which I'm super proud of. So there's that. Thank you, guys.
Thank you, Andrew. I can consider Andrew a force of nature at Lenox Hill, and I'll be very sad if he ever leaves. And to echo, the education bit, I would say is definitely part of the biggest satisfier I have. If I can teach a student one thing and they take that forward for their careers and say, I remember Arthur taught me how to do that. That to me is enough satisfaction. I really don't need more than that. So I appreciate Andrew's work over the years in education, what he continues to do and what I know he'll continue to do. And I can only hope to emulate a lot of what he's done. So thank you very much.
I'm just trying to be like you, Arthur. Just trying to be like you.
You're ahead of me on all this. Another person we all want to be like is Elmo. Elmo, again, as I mentioned, when I was a student in Lenox Hill Neurosurgery back in 2006, Elmo was there. He was my preceptor. He, in all respects, is my mentor, and everybody I teach forward is a reflection of what he's taught me. And that's why I call him the OG. Because he's just an incredible person. He has the best Bitmoji in the game. I dare anybody to show me better. And I'm really glad I can finally get him to talk to all of us and tell us about his journey and what he sees. So, Elmo, I hope you're able to unmute yourself in chat.
Can everyone hear me?
Yes.
Oh, great. So this one will be hard to follow. Andrew is a true legend in Lenox Hill Hospital. Every time we're in trouble, who do we call? Andrew to the rescue, and he's always there. So my name is Elmo, and I'm not kidding, it's Elmo. And yes, I know, each one of you has a kid, a niece, a cousin who just loves Elmo. And no, by the way, I am not ticklish at all. Kind of glad that I did not grow up and went to school as a child here in the US, because it would be hard with this name, I think. I migrated here from Brazil in my early 20s. I went to the natural pathway of most migrants that come here as an early adult. Quickly learned Spanish to survive because it's quite closer to Portuguese. Got me a job as a dishwasher, enter into ESL and English as a second language. Moved on to get an EEG, a high school equivalence program. And eventually I joined Bronx Community College, got me a degree in medical technology while I work as a cook at night, going to school during the day. Got a job as a blood bank technician, did that for quite a few years, got married, had my first child, and was just then that someone one day walked into the blood bank and gave me an application and just told me, you should apply for this. And it just happened to be an application for Harlem Hospital PA program, Sophie Davis School. I've never heard of a PA. I had no idea that profession existed. What was it? And that person did not provide me much of information, just kept repeating the money is really good. During my time of school, I also did some part-time job as a phlebotomist, going from room to room, drawing blood, and that little contact with patient, with that minimal patient care, I've kind of missed that, working in the lab all the time, not seeing the patients, not only dealing with specimen, but not a person behind of it. And I applied. God knows how I got in. But I did, and now we are having this conversation. I graduated in '98 from, again, the Harlem PA program, Sophie Davis School. Got my first job at Woodhull Hospital in general surgery. Worked there for 4 years, and then I moved to Lenox Hill Hospital, also in general surgery. Stood there for a few years, and then I moved to neurosurgery, primarily to political reasons. Things was happening in the hospital at that time. During those years, or from them to now, from '98 to now, of course, we have seen tremendous amount of growth in the PA profession. The most relevant to me personally is that now we are acknowledged, we have recognition. I remember going, especially during my rotations and in the first few years, for every person that I met, even hospital staff, I would have to explain what was a PA, what was the privilege that what PA could or could not do. There was tremendous amount of suspicions about us. Can this individual really provide care? Can this individual really write a prescription? Do they know what they're writing for? During the rotations, I remember working with chief residents and residents who have no idea how to teach us, how to place us. We need, in a sense, as a student, to teach them how to teach us, to be somewhat aggressive in placing ourselves in a position where we could learn something, we could do something. If not, you would just be placed on a corner and watch things to happen. The relationship with the MDs are also kind of tenuous. There was not much trust. You'd have really, again, to be kind of aggressive and reinstate what you are, what you can do, what you cannot do, until they would develop some kind of trust and allow you to participate more with the patient care. It was a struggle to really be a full PA in the first few years. Some institutions were more comfortable with PAs, others was very reluctant to reinstate PAs in the community. And what I see now, presently, is a tremendous change in the scenario of recognition, at least in the hospital setting. We are well known. Our qualifications are somewhat well known. There is a much greater degree of trust. There is a much greater degree of trust from the MDs in this partnership, providing care to patients. So we went from relative obscurity to relative recognition. And I do say relative because there is a long way to go yet. And I believe that it will be a natural process, not a forced one. I believe that if you force the issue too much, we may create unnecessary quarrels with other fields in healthcare. So we do help naturally that PAs will be more and more recognized and as an essential partner in providing the possible best care to patient. Another great, and especially recently, and especially what's happening with neurosurgery right now that we see is the immense great quality of the teachings for students doing the rotations. And I think the main cause of it is because the preceptors are mostly now PAs themselves. So it's PAs, precepting PAs makes a tremendous amount of difference. Again, during my days, I was mostly residents and chief residents who were too busy to pay attention or perhaps to somewhat intimidated by the prospect of teaching. They didn't know what to do with us, basically. But now the students coming in, they are welcomed. They were placed in the position of almost colleagues and work almost side by side with the PAs, going through all the teachings and care that they need. And I see them coming out of rotation, pretty much ready to start a profession. And I think that makes a tremendous amount of difference of how PAs are better recognized because they already start at a better position than when I started. Another thing that I think is making a great difference is the relationship with the MDs, with the doctors. And that's because the newly graduated doctors, MDs, they have had during the residency contact and experienced this partnership with PAs. So they become newly MDs already comfortable and already welcomed to this partnership with PAs, which also is a great advantage for us and a big difference from the some 20 years ago. One important aspect that is changing now that I think is also very welcome and we need is more PAs get into administrative positions in institutions, because I think that voice is important for the profession. A possible pitfall, something that I'm somewhat concerned, is the risk of compartmentalization, so to say, of the profession. In a way, we need to be careful to not allow the profession to become some kind of glorified technicians. PAs being hired to do one or another procedure and do only this procedure over and over again. PAs being hired to be just line placement, sonogram assisted line placements. PAs being hired only to do vein harvesting, to do so just one kind of procedure. And I think it's a risk that the profession will become very limited in being, again, glorified technicians. We need to make sure that we prioritize being a full, complete clinician. It becomes very easily for institutions to start hiring PAs to do just one thing, and perhaps even become comfortable for the PAs to be doing only one or another thing and nothing else. But that's a risk that the profession may lose its major characteristic. It is to be a clinical care provider at all fields. What is it that I like to see for the future? I'd like to see more stronger political voice of the PAs, not only for the profession itself, which is important and needed, but I also think that we can have a very positive input in the general public health. So I'd like to see more PAs, especially when we get enough clinical experience and start time to move on, and some of us who have this characteristic move on into administrative positions and also in public health care. I think it will be very good. And at the same time, paradoxically, I like to see a little bit of return to the past. To remember why is this, or what for this profession was started to begin with. That was to provide needed health care to communities who are deprived of it. And that doesn't mean only going to the countryside, even the metropolis. I mean, you can go to the South Bronx today and see tremendous need of healthcare right now. And I would like to see PAs moving toward that, to fulfilling that whole of, in partnership with MDs, of course, fulfill that void that we have, again, the metropolis and also in the countryside. The partnership with PAs, I think, with MDs, I think we will continue to grow naturally in a natural process, as I have said before. For myself, retirement nearing, few years ahead, and I will hope to be able to provide some volunteer care in small healthcare communities in the South Bronx or somewhere around where I live right now. That is my family. This is what I have to present, and I thank you for your attention.
Oh, thank you very much. I've known you for so long, but it's the first time I've heard you present, and that was really wonderful. And that was it was such a great history, and I agree with you on so many levels, with being pigeonholed into specific, places of work, and you know this as well as I do, that we used to do everything, and now things are starting to become, in many institutions you're set in a role. So it's important to be well-rounded, and I use for us ACP specifically in practice, you want to be marketable for your future. You want to think to your future, and to how you want to impact health, be it education, administration, or being involved in the community. And I think our next speaker can, I think, speak to some of that. And Elmo, thank you so much. And hopefully we have a little time for Q&A, but if not, we'll provide our contacts in there. But I do want Allison to tell us about what they do.
Hey everybody, my name's Allison. I use they, them pronouns. I'm a ACP supervisor I work primarily in outpatient gynecologic oncology, as well as I do queer and trans affirming general GYN care at Lennox. So I just kind of love to share some of my journey and some of the lessons I've learned. So sorry, I didn't have enough pictures of my team, so you're getting pictures of me. Some throwbacks here. So I started college certainly with the plan of being a bio major and going to medical school. But I had, a few changes along the way that kind of changed my plan a little bit. The first is, once I had completed my pre-med requirements, I just had the availability to take a psychology 101 class, and I fell in love with it, and I fell in love with the human brain, and so I changed my major to neuroscience, which, if you're not familiar, I think is a great mix of both the hard sciences, but also, animal behavior, human behavior, psychology. Obviously, you're here, the brain is an amazing thing. So I kind of changed my major, but had kept the same plan of going to medical school. But after my sophomore year, I stopped playing softball. So I ended up with a lot of free time. And I got involved with a mentorship program at my college, honestly, similar to Big Brother, Big Sister. And I got really involved with that. And I was very fulfilled just helping the kids out. And I actually took 3 months, and I lived in a low-income housing complex, and I ran like a early education after school type program with these kids. And I started to think, like, maybe I wanted to be a social worker, maybe I wanted to do something completely outside of science, but I couldn't, because I'm just in my passion, I'm too into biology. I'm too into physiology. So it kept drawing me back. But it made me think, like, what's the best thing for me? And like Denesha, I had encountered PAs just getting healthcare or being with my parents when they get healthcare. And it kind of opened up my eyes to this profession, which is both the medicine, the science, but also a little more, depending on your specialty, I should say, but a little more accessible and a little more social support as well, like Artur was saying with the therapist piece. So I thought, you know what, I'm gonna go to PA school and I'm gonna see how this goes. So I graduated college in 2007 and then I went to LIU Brooklyn for PA school and I graduated in 2009. My love for physiology always kind of drew me to reproductive health care. So when I graduated, I've been practicing for 13 years. So I did a little bit of inpatient medicine, but primarily my career has been in outpatient OBGYN and the last like 10 years in GYN oncology. So, you know, I've enjoyed that. But again, similar to Denesha, I started to think about the future and the next steps. And so I went back to Hofstra and I got my MBA in strategic healthcare administration last December. You can see in the picture, my daughter's maybe the most excited on that day. And you know, I haven't made the transition yet, but I'm hoping to transition into administration or operations, much similar to Andrew. You know, I think that every day I touch my patients, I touch my practice, but in reality, that's a pretty small number of people. So if you're leading strategy, if you're building processes and teams and departments that function well and give high quality healthcare, then you get to amplify your touch, right? So that's kind of what's drawing me to that world now. So I guess I'll share some of my thoughts, what I've learned over these last 13 years. The first thing I would say, if you're looking at the pictures, you know, there is an obvious change in my appearance. And a personal thing I've been going through that I think is tied also to a lot of my career and professional development is that, you know, I'm trans and I came out, you know, about 5 years ago as a transmasculine non-binary person. And you know, it was a trip in a lot of ways, you know, to be doing that in your mid 30s with a career, with a family, with kids. And it was a process, but I have to say professionally was probably the hardest piece for me. It was really hard to think I could be comfortable coming and being my whole self at work. You know, what am I going to make my colleagues uncomfortable? Am I going to make my patients uncomfortable? And how to handle that. But as I'll talk more, what I realize is the more comfortable I get in who I really am and sharing who I am, the more my world grows and the more I meet new people and I'm feeling more fulfilled. So the first lesson I've learned is that healthcare is a team. We all have a role. All the other panelists have talked on this, so I won't go too deep into it. But I think when you're not a physician and you are first starting, it can be really intimidating when you look at the hierarchy of the healthcare team. And I think I spent a lot of time being like, well, I don't know enough clinically to raise my hand and correct an attending. Oh, I don't know if I can do this, you know, but it doesn't matter. Once you get comfortable and you really realize some of the hardest things I've learned in my career have been from nurses, they've been from medical assistants, and some of the people who have missed things that I've caught have been well-respected attendings. Like, we all are here, we all have value, and healthcare is hard. You need a whole team, and we all have different training and way of thinking of things. So I think to really work in healthcare, you have to let go of that ego in terms of, you know, people who maybe are below you, but also have the confidence in yourself to speak up to the people who technically are above you, because we're all needed. And for the team to function, we all have to come and be there and say what needs to be said for the patient, because we take care of people, you know, we don't take care of robots. So you can't let mistakes happen, and you always have to make sure you're doing the best you can. And then, like I touched upon, being yourself can be your best asset, you know. And I think when you think about professionalism and what's appropriate, sometimes who you are as a person outside of work, what you're into, doesn't feel appropriate. But I think we're all people. We're people, we work with people, we take care of people. So you need to connect and you need to be yourself. And so along that, you know, let your passion be your guide. So my passions, I think, are really high quality patient care and advocating for health equity, especially in the LGBT community. And I found that since I've been more out and open about my trans identity, you know, I've been able to get more and more involved in different diversity, health equity, and inclusion initiatives. And that's some of the stuff I'm most proud of in my career. You know, I put up a couple things recently, but this Welcoming Spaces webinar I've been working on for the past 2 years with the LGBT Cancer Network, as well as the Society of GYN Oncology. And it's kind of wild, it's coming into fruition. Basically, next Monday, we published the last webinar. And I can't tell you how weird it was to be approached, to be like, oh, you know, you're a subject matter expert. Come help us with this. And it was like, me? Like, the Society of GYN Oncology is almost predominantly doctors. There's some NPs, some PAs, but it was such a moment of like, really, me? Like, nobody knows this better. But it's been amazing, and it was really validating, and it was created just by going out and being myself and talking about experiences I've had, good and bad, and educating others. You know, even like today, right? So I was talking to, my wife recently gave birth. I was talking to someone at Lenox Hill just about making things comfortable for when she delivered. And that launched into being part of this trans communication education project in Manhattan. And then I'm speaking about that. And then Artur emails me being like, hey, I just heard you speak. Like, maybe you want to do this. And it's really rewarding because it's like, this stuff is so fun for all of us, right? I think the panelists get as much out of this as the rest of you, as the audience. But it's great just being yourself and being open and connecting with others to see how that grows. And I think that's always the thing you need to remember about your career, healthcare or otherwise. It's like, we're all people and we're here for people, you know? And that brings me to my next point. You know, I think working in healthcare can be hard and overwhelming at times, right? Some days there's no lunch. Some days you know you're getting out very late. Some days every patient is so sick that you can't even catch your breath trying to keep everyone safe. But there are people in front of you, and you can't just do the steps of your job. Like Andrew said, you know, monkeys can do most things, but they can't connect as a person. They can't be here as a person. And I think that's the most important thing for anyone who works in healthcare is to remember, like, I may be having a bad day. We may be running an hour late in the office and it's causing issues for me, but the next patient I'm going to see is probably getting a cancer diagnosis. The next patient I'm going to see is a trans person coming to a gynecologist who's really scared and vulnerable. And you have to be able to sit with that and just give all of your patients your time and your empathy and compassion and really see them as they are. So I think anyone considering healthcare, you know, that's what I've learned and that's what I wish we knew. I think the future for NPs and PAs is bright and huge. I think independently our professions have our own battles to fight legally and, you know, politically, but it's our field is growing. And it's never going to stop growing because that's the nature of healthcare. And we've proved that we help patients and we improve outcomes. And that's kind of the long and short of all of it. That's all I got.
Awesome, thank you. That was wonderful and exactly what I hoped it would be. And you know, I'm putting this in chat and I'll say it out here is thank you guys so much for doing this with me and you know, putting in your time for those of you, some of you are on vacation right now and some of us are home or at work doing practice. So I really appreciate your time for this and putting together some info and showing us pictures and talking to us about your journeys. That was really wonderful. And I haven't heard most of that myself. So it was great for me as well. And I think we do have some time for questions. If anybody has them, I don't know if Quinn, you want to, I think I'm seeing them popular in the chat here.
do you
So
have
what-
access to the chat? Oh yeah, you do.
Okay. Yeah, I do. So I see one great question is, how did you navigate the decision between so many different options in healthcare, knowing which is best for you? I will let some people tackle this one as well, but I'll say that you don't know till you do it. Clinical rotations help. And we're humans, we're mammals, we're adaptable. You could do anything you want to do. It's purely based on perception, if you know or don't know. So I wouldn't worry about making the right or wrong decision because there is flexibility in our professions. Anybody else want have any, Andrew, I don't know if on the NP track it's different in education path. How do you know what you want to do?
So in the nurse practitioner tracks, you have different types of nurse practitioners. There's family nurse practitioners. Like I said, I just did a postmaster certificate in that. Adult care or acute care nurse practitioners. There's CRNAs or nurse anesthetists who worked as an anesthetist at the bedside. And then there's also psychiatric mental health, pediatrics. So there's all different types, and you always have the ability to specialize afterwards.
There's a question of what roles the PAs and Ps played during COVID. That first picture I had of my colleague from full OPP gear, all of us here were in the depths of especially a lot of critical care during COVID. We were a huge force and really helped offset a lot of burnout that residents were starting to experience. We played a huge role in that. And I think that elevated us even more as advanced care practitioners because we showed up and we were there. Please.
I was going to say, I agree. I think one of the things that was really unique during COVID was that it reinforced the idea of this interdisciplinary team, and that there wasn't a hierarchy, right? At the end of the day, everyone played a role, whether I always tell people in critical care, it was the Super Bowl that nobody ever wanted to happen, because our passion in critical care is to take care of critically ill patients, but it just came in droves. But I think we really showed as advanced clinical providers the depth and breadth. Elmo was talking about elevating practice and making sure that we continue to all be able to practice in our highest level of scope. And I think that the pandemic really truly showed that. I still remember a day where I was placing invasive lines and working alongside Dr. Langer and Dr. Bookvar, who I've never got the chance to work with. And I think that was the other big thing about, as much as there was bad about COVID, it really showed, that we were a healthcare family and a community working together. I don't typically get to work with Dr. Bookvar and Dr. Langer just because of my specialty, but then being able to work alongside them and really be able to provide care together was what was really powerful for me.
Yeah, and I think that COVID was a learning experience equal to just about everyone, to every level of care provider, right? We were all learning together about this disease, how to manage and treat those patients. So it was leveled to all fields of expertise. Everybody was learning together how to work, and I think that was one great thing, that everybody worked together with one single objective.
Agreed, Elmo. I think we're out of time because it is 11 o'clock. I think for those who have unanswered questions, especially in terms of what our roles are, our day in the life, I see a lot here about MBA and other questions, COVID, please email us. Again, I posted my email, posted it again. And if there are questions directed towards something that's not for me to answer or panelists, I will forward it along to our panelists. That way I'm not emails in the chat. And, we're more than happy to answer all of your questions as they come in.
Thank you guys so much. That was amazing. I know everyone in the chat is saying thank you. And we really appreciate you guys spending your time with us.
Thank you. For those here next week, I'm doing one more of these with some other colleagues of mine, and a little more show and telly. Should be fun.
Thank you, Artur.
Thank you.
Thank you.
I could also post his email in the Facebook, so you guys can all have access to it. That's okay. Okay, I'm gonna promote our next speaker to panelist, since it is 11 o'clock.